Erectile dysfunction is the inability to get and or keep an erection that is suitable for sexual activity. And erectile dysfunction can be as simple as not getting a great erection that's as firm as what it was in the past, and that may be bothersome for patients or their partner. Additionally, erectile dysfunction may be that patients aren't getting any erection whatsoever, and they haven't had erections for a long time. Even the patients that aren't waking up with erections, haven't had an erection for a long period of time, those are men we can treat, and it's a wide spectrum of places that we're going to meet patients at in the office. Erectile dysfunction can be extremely common depending on what disease process we're talking about. For men with heart disease, we'll see a high number of patients have erectile dysfunction, upwards in the 70 to 80% of men depending on the scenario. For men with diabetes, we'll also see a very high percentage of men with erectile problems. In other cases, we'll see that men even in their 30s and 40s may struggle with erections. In fact, for men who are undergoing fertility treatments and struggling with conception with their partners, up to a quarter of those men will struggle with erections. The two most common causes of erectile dysfunction are arterial disease, such as those things that will cause heart attacks, heart disease, strokes, as well as diabetes. Men with diabetes will have both the blood flow affected as well as the nerve function that would start the erection to begin happening. Men with the arterial disease have inadequate blood flow coming in, and if there's inadequate blood flow coming in, what we see is that the erections are not strong enough. They may be more difficult to maintain, particularly with any sort of position changes or activity. Beyond those, we see a multitude of other things that can cause trouble with erections. Erectile dysfunction can be caused by certain medications, including antidepressants, as well as high blood pressure medications. Now with that, don't just stop your medications. There's ways we can work around that. Erectile problems can be a result of prostate cancer treatments, or any sort of pelvic surgery can cause trouble there. There are certain hormone problems that can cause trouble with erections that need to be looked into as well. And finally, there are some patients that develop a psychological cause of their trouble with erections. In fact, for about 1/4 of men going through fertility treatments and struggling to conceive, we will see them have trouble with erections as well. Erectile dysfunction is primarily diagnosed based on discussions with the patient. Patients are not coming in and telling me they've got erectile dysfunction when there really isn't something there. However, there are other things that we're going to look into in association with the trouble with erections. We'll look into hormone panels, looking at other potential causes that are there. We may even do a particular nerve type reflex study to see if there's a potential nerve association with the trouble with erections. And then we may also consider using what's called a penile Doppler ultrasound. It's a study where we're actually going to measure the blood flow in, as well as the venous blood flow out, to get a clearer picture of what's causing the trouble with erections. Erectile dysfunction can be prevented. It's going to be all the things we know that are good for our heart health. So limiting our fats and alcohol intake, getting some exercise, eating plenty of fruits and vegetables. Additionally, other things that are going to help us are going to be trying to minimize the risk of diabetes, looking to keep our blood pressures in check, as well as making sure that we are minimizing stress within our lives, which is certainly easy to say, but hard to sometimes put into practice. Seeing a specialist for erectile dysfunction is going to give patients the best opportunity to treat the underlying cause, as well as prevent progression. Just like if you were going to have a big surgery done, you'd want somebody that was doing it often. Even treatments for erectile dysfunction, seeing a specialist is going to allow someone to think about things a little bit differently, rather than just throwing a medication that may be a Band-Aid when the underlying cause could actually be treated. There are a number of options for treating erectile dysfunction. Generally, what we'll start with are the lifestyle changes. Trying to stop smoking, minimize alcohol intake, starting to get some exercise, as well as improving our diets. Those are going to be the things that are going to be long-term benefits as far as preventing progression of the trouble with erections. Beyond that, generally we'll start with medications. The oral medications that we know by the brand names of Cialis, Viagra, Levitra, Stendra, or the generic names sildenafil, tadalafil, vardenafil. those are going to be the medications that will generally begin. If those are not effective, then we jump to our next options. Our secondary options start to include a vacuum erection device, a little intraurethral suppository, so a little pellet that'll go in the tip of the penis and slowly absorb to help provide an erection. We do have injections into the penis that will actually help guys with an erection. Don't worry, they work great, and most men hardly feel the injection. And then we also have penile implants. The penile implant is a more surgical approach, however well covered by insurance, and satisfaction scores are quite high. Beyond that, we do have some more experimental things that are ongoing currently, whether it's the low-intensity shockwave therapies, the stem cell type treatments, or even the platelet-rich plasma type treatments that hopefully in the future will provide better benefit, but right now really should be considered more of an experimental trial type approach. Choosing the right treatment for patients really depends on the specific scenarios for their situation. For a patient that's single, that may not have access to having a refrigerator or being able to keep a needle with them, the injections may not be the perfect option. However, for a man who's post-prostatectomy and the nerves have not recovered the way we had hoped, the injections may work great. So I think really it's looking at each individual case, and that's where a specialist comes in. It's not a blanket one size fits all. This is a specialized what's going to work for patients and their partners. And we want to look at it not just from an effectiveness standpoint, but what's going to cost an appropriate amount so that it's not too expensive, what's going to allow for the normal amount of spontaneity, as well as for some patients, how frequently do they want to have sex? And things of those natures we address and then put the pieces together to determine what's the right treatment. Satisfaction rates for the different treatments vary quite a bit, and a lot of it depends on which medical study you look at and how we ask the question. If we ask the question, did the patient get an erection? That's an easy answer of yes or no, as opposed to, was the erection hard enough for penetration? Was it considered a normal erection, and did it last long enough? Which involves much more of the details we really look at for sexual medicine. Typically for the pills, the Viagra, Cialis, Levitra, Stendra, I would say the success rate for most of those patients is going to be right around 50 to 60%, which does leave a lot of patients that they don't work for. When we start to look at the vacuum erection device, it will very much provide patients with an erection. However, most couples don't find it as the best option for their situation. When we start to consider things like the injection therapy, the intracavernosal injections, or what's called EDEX, Caverject, or Trimix, those types of treatments can be quite effective. However, for some couples, they're just not as satisfying because of the spontaneity component. When we look at the penile implant, it's probably where we have the best data to actually look at success and satisfaction rates. When we look at success and satisfaction there, we see a greater than 90% satisfactions for both patients and their partners when it comes to the penile implant. The long-term consequences of not having erections are variable. From the simple standpoint of the health of the tissue within the penis, we do know that if patients are not getting erections over a period of time, they're not getting adequate blood flow, they're not getting healthy new blood, and therefore we can start to see some atrophy or loss of the size and stretching ability of the penis. So we do see penile shortening over time. But we also must consider the psychological portions of it. And we see that for some men, not having erections means that they don't go with the non-sexual touch aspects of a relationship as well. So we can see the intimacy component start to change. We can see the interaction between partners change a bit. And that's going to be specific to each patient, each couple, as to how much of an impact that has.